Okay. Hi, Dwight. Welcome to the Big Unlock podcast. My name is Ritu Oberoi, and I'm one of the co-hosts of the podcast. And we are very happy that, this is season 6, and we are really, glad to have you back, delighted to have you back and hear new perspectives on, especially AI and, what your initiatives are at your new organization. So we can get started with your introduction and then, get into a few topics. Thank you.
Great. Really great to meet you and really great to be here, Ritu. I'm Dwight Raum, and I am the Chief Digital Information Officer for Rochester Regional Health. We are a health system that's about 9 hospitals large in Western and Northern New York. And we kind of span the spectrum from very acute urban care hospitals that are quite large to very small regional rural hospitals as well. We have a large ambulatory practice as well throughout that region, and we really take care of patients from birth to death, in every aspect of healthcare in between. I've been with the organization now for just a bit over a year,
Okay.
but prior to coming to Rochester Regional Health, I was in the startup world for a short period of time, and then prior to that, I served at Johns Hopkins Medicine as the Chief Technology Officer and also the interim CIO. So I've been in healthcare for quite a long time, come up really as a technologist, which is increasingly unusual, I think, in senior leadership roles for IT. But I've really enjoyed my time in healthcare, and the mission really calls me out.
Okay, great. That's a very interesting introduction, Dwight, because seems like you've, seen all 3 aspects of technology and implementation, being in John Hopkins, which is like, world-renowned teaching hospital, and then you went to a startup, you said, and then now you're here at Rochester. So what was your role at the startup, and what did the startup do before we get into your current role?
Sure. So it was technically a joint venture between Independence Blue Cross and Comcast. And this startup was called Quill Health. At the time, we were trying to build a in-home monitoring system that would allow seniors to age in place.
Okay.
So that consisted of all these sort of IoT sensors that we had throughout a senior's home. And then from those sensors, we had AI models that were running to anticipate and predict certain behaviors and patterns. And then insights would be drawn from those data and shared with caregivers. So it was a really interesting idea, just struggled to kind of get it across the line, if you understand what I mean. But I think it has tremendous potential, and it actually sort of speaks, I think, to the opportunities we have with signals and AI and how that can really transform the way we provide care to people.
Yeah, that's very interesting because we had a webinar yesterday in which we were, presenting some case studies. And one of the case study we were going to present, but we didn't, was for Cherish Health. And they do almost, very similar thing, radar based. They have a device and they use it in senior homes, and they're able to detect falls and go through walls and see, anticipate using AI. So, yeah.
Yeah, I mean, it's the technology's evolved certainly over the last several years, and radar fall detection has really improved.
Yes.
But I still think there are a lot of challenges, in terms of privacy and getting over that technical hurdle to have seniors really adopt and use the technology with a level of trust.
Mm-hmm.
Those are still barriers which are not technologically easily surmounted. Yeah.
Absolutely. Okay, great. So tell us a little more about your role at Rochester Health and, what the digital landscape is there and what is your, experience with generative AI and what are some of the initiatives that are happening at your current organization?
Absolutely. So I mentioned we're a 9 hospital system. We are mostly on one EMR system. We are an Epic shop, single instance. And when I say mostly, we over the years have grown through acquisition and have a number of practices that are on smaller EMRs, but we are, slowly but surely moving them all into a single instance of EMR. In terms of our initiatives, I put them in a couple of different categories. The first is really trying to optimize the system and engine of delivery for care that we already have. And that means, ensuring that we get throughput through the system, that we're doing so in a safe and high quality manner, that we're providing access to our patients. And then really the second half of what we're trying to do is transform the way that we're delivering care. So
Okay.
going from this traditional fee-for-service model into a much more risk-based, value-based type of model, where we're
Mhm.
treating the patient's outcomes for their outcomes instead of just, on a transactional basis. Think about all sort of the changes that drives in terms of how the technology works, but then also how our operators, how our clinicians provide care. It's a transformational change to the system. And one that I give a lot of credit to our CEO, Chip Davis, Dr. Chip Davis, is really leading the charge on that and trying to plan for the future. When 2030 comes around and CMS starts to pay on value in a much more earnest way, I think we're going to be very ready in Northern New York to take on that challenge.
Great. So in terms of, the clinical access center, is it like a unified center? Because we worked with Centara recently, and that was like a huge, multi-year project that they did to bring everything into one place. And then now they have actually AI implementation on top of that to do the
Yeah,
routing. And they've implemented something very interesting, which we did a webinar on the case study at Centara. And they said because of the AI that they've put in place in the call center routing, the nurses are able to take flexi time off because they can predict, when the usage is going to be lower. And that's been a huge plus point and a big, bonus for them. So
yeah.
your thoughts
So
about
I think it's a compliment for us. We do have a unified call center, and we are absolutely using AI
that?
on those calls to do call routing, to do prediction of when we have higher call volumes, et cetera.
Exactly.
And
Yeah.
we've been able to, I think, really drive efficiency using AI in our call center. But our call center is literally right next to our command center. So we're looking at our overall system operations and understanding what the volume looks like and where we need to shift resourcing, where we need to shift patients, et cetera. And combining that with a call center, I think is incredibly powerful because it's call centers are not just receiving calls; we're also driving outbound
Absolutely.
traffic as well. And then I think the third leg of this stool is we've just rolled out a digital front door on our web experience, our digital experience for patients, and
Okay.
is really providing I think robust capabilities for our patients to serve themselves, right? To gain access for scheduling, to find the providers they want that are closest to them. And if you look at it, we're really trying to cover the entirety of that gamut to serve patients as consumers as best we can.
So for that digital front door piece, do you have AI as well? Like, is it virtual chatbots or how does that work? What have
We're
you?
not deploying chatbots in a very robust way at this point, I would say. And honestly, I'm not sure that I see there's probably some front door kind of aspects of chatbot, but I don't really see that as being a very robust way to provide care. But that front door does provide access to direct virtual care. So we're able to provide access to patients, usually within an hour or two or less, to see a provider almost right away. So
Mhm.
it's that complement of access and then technology delivering the providers to the patients, right where they are in almost real time.
Okay. So Centara said they use something called Nexidia for, the AI part on the call center. Do you know
Mhm.
which AI implementation you guys are
Yeah,
using?
so we are a Genesis customer, and there are embedded AI tools within Genesis, and that's the basis of what we're using.
Okay. So Dwight, how big is the technology component at, Rochester Regional? And do you see a role for like a chief AI officer? That's like a hot topic we are seeing these days. Ethics, governance committee, chief AI officer, like,
Yeah,
yeah. So would love to hear your thoughts on that.
yeah, that's a broad question. Let me take a shot at it. So in total, we're about 400 people in our AI, I'm sorry, in our IT shop.
Okay.
I might have Freudian slipped there a little bit, and I am very much trying to reorient the organization to think about AI, but more broadly innovation, right? So
Mhm.
how do we bring technology to bear and new ways of thinking to transform the way we provide the technologies and tools that we deliver? Um, Specifically to your question though, around do I anticipate us having a chief AI officer or something like that? And the simple answer is no. I don't think that makes a lot of sense. Quite
Okay.
frankly, what we have done though is created a center of excellence for AI, and
Mhm.
this is a collection of the appropriate players that need to be at the table to really do two things, right? There's a push and pull for AI. We have a
Mhm.
tremendous demand from our operators when they go out and see, new tools being deployed.
Absolutely.
There's a lot of like, hey, can I get this?
Mhm.
And we need to be able to react to that and be thoughtful about, oh, what are the privacy concerns? What's the contract structure? Is it ethical? All the appropriate teams are incorporated into the COE to start answering those questions. So when there is a pull, that we have, a very thoughtful and responsible way of adopting AI. But I think there's a dual role for this AI COE as well, and that is to really push the technology as well. We have seen just such rapid, turnover and development in AI in just the last 6 months, the last 18
Absolutely.
months,
Mhm.
that it's impossible. I mean, truly impossible for one individual, or for that matter, our providers, to
Mhm.
really understand the landscape of technology and the enhancements that are available. So that second part of our responsibility in this AI COE is to really articulate the art of the possible. And we are maintaining an initiative list of opportunities that we think are ripe for AI, where
Okay.
we can deploy a capability, whether it's LLM or machine learning, that might have an immediate impact or have the opportunity for really significant impact.
But even for all your AI implementations, are you going to stay within Epic? Because Epic itself is building AI tools, or are you looking to, integrate with Epic, or you think you'll go outside of that? What are your thoughts on
Yeah,
like
I
that?
think we always will look at what we own first,
Mhm.
or Epic is a chassis in a lot of ways, and we can plug in the different Epic modules and activate them.
Mhm.
And certainly we're going to look there first, but that doesn't mean we're going to look there exclusively.
Okay.
We talked a moment ago about Genesis providing incredible capabilities from an AI perspective. You
Mhm.
know, Obviously an example that is outside of Epic, integrated, but is independent of Epic. So no, I don't think this is exclusively an Epic play, but there are some really, I think, low hanging opportunities with Epic, just to to vet the tool, ensure that it provides value, and then activate it for our providers.
Okay. I'm just mulling over your answer because, other CIOs we've been talking to and other CTOs, they do feel the need for a chief AI officer just because of the, reasons you mentioned yourself, the trust and the governance. And like you said, the pace of change is so rapid that it's difficult for, one person to keep up with that. So some of them have the viewpoint that you need a dedicated person whose, job function and role is to kind of look at that landscape, understand what's happening, and decide what the best thing to do is for the company. So
Yeah,
just devil's advocate here and trying to look at both sides of the coin.
yeah. My reaction to that is, if we were in the business of developing AI on
Mhm.
our own,
Yeah.
I would agree. So I think if we were really in the business of not providing direct care to patients, but instead technology developers, I would agree with that. But we're not. We are a system that is intending to serve our patients.
Mhm.
That's our priority, is really patient care, and we will use AI in the service of that. I think it does require a collection of experts to do this.
Exactly. Yeah.
So from a legal standpoint, from a privacy standpoint, from a algorithmic safety standpoint, maybe a chief AI officer could be the lightning pole that sort of concentrates that activity. But
Yes.
quite honestly, I think we've come up with a methodology that works well for us in the
Okay.
COE,
Mhm.
that allows us to bring together those experts. And more importantly, I think it helps us to align the interests of all those experts as well. Even if
Mhm.
you had a single, AI, chief officer of AI
Still
or
need-
whatever,
Yeah.
they still have to orchestrate all of the soft power and influence to actually drive real change.
Absolutely.
In my view, the AI COE approach really sort of forces that to happen right out of the gate.
Yeah, that's a very astute observation, Dwight, because that's exactly what we learned through our webinars, that it cannot be mandated. Everybody has to buy into it. It's a behavioral change, especially
Yeah.
with some of the newer tools coming in. So yeah, so that's a very good observation. And yeah, the only other point of view I have on this is something we again talked about at the webinar yesterday, which is that basically EU has now made into law the act that, if any company is providing AI at any point to its organization, then they've mandated training and they've mandated different levels of training. So what do you feel about the training landscape? Are all your employees going in for like AI training, or what do you think,
Yeah. So
or
no, we have not
outsourcing?
mandated, what I would describe as sort of broad-based training for AI yet. I think that's something that is likely possible to happen, but it sort of depends on the circumstances of the tooling that we're talking about deploying. We certainly talk about it, as leadership teams very
Mhm.
broadly, but at this point, I haven't seen the need to do this in a less targeted way. So certainly, as we start to approach the deployment of smart ML models to do predictions around diagnosis or therapies or what have
Yes.
you, there will be very targeted and I think intense training around each one of those.
Okay. So as of now, everybody just goes and learns on their own, or like how does that work?
Yeah, so I'm not sure I follow what your question is. Do you mean learning the individual AI tools
Yes.
or
Or
just,
just generally about AI in general, like you mentioned LLMs or,
yeah?
ML tools. Yeah. So everyone's just learning on
Well,
their
no,
own.
I think, as I said, we and I personally have certainly hosted a number of what I would consider like webinars across our organization. That
Oh,
is to try and provide instruction and baseline information about how these tools work. However,
exactly.
we're not at the point yet where we're providing formalized training on that. And
Okay.
I think the challenge is, healthcare is a very busy and in many ways understaffed industry. So
Absolutely.
capacity is of a real concern. And when we're fighting for the eye share of our providers and of our care deliverers and our operators,
Hmm.
we have to be very cautious about how and when we use that and make sure that it's impactful. My sense is that as that becomes acute and we identify specific opportunities where we want to talk about how to use a generative AI tool, we
Yes.
will do so. We have also certainly provided guidance on, we do have an AI policy that we've
Yeah.
deployed as well that does specify how and where and what is considered safe use for generative AI at this point.
Oh,
That has certainly been socialized as well.
okay. But like in your, in the hospital environment, do you have people who have, Chat GPT open and they might be uploading things to it without knowing that, whatever they're uploading is going public and maybe used by the model for future learning? Just, even things
Right,
like that.
right. Yeah,
Yeah.
I mean, so that's been part of our internal communications campaign about
Mhm.
that policy, about what is appropriate use.
Yeah.
It is one of those things that's harder to police.
Hmm.
Um, and certainly I can't say for certain that hasn't happened, but there is certainly guidance out there and education about
I mean, it
what is
might be
appropriate.
completely unknowing. Like people don't even
Yeah,
know that, that's the
yeah,
terms of use for ChatGPT unless you explicitly opt out. Anything that you type will be used by the model
right,
for
right.
future
Can
learning.
be used to
So
train for future. Yeah,
exactly, exactly.
yeah.
Okay, great. So Dwight, I think talking to multiple CIOs and CTOs across organizations, the main success story with generative AI that we're hearing over and over again falls into two broad categories. One is scribing, and the other one is ambient. So, what has your experience been with either of these two? And is there a success story you would like to highlight?
Yeah, I mean, I think honestly, we're a little late to the game. We've just started our pilot for ambient digital scribe. We've done some very early testing, and I think, it is sort of an obvious win for our providers. The
Mhm.
unburdening of them in terms of pajama time and the amount of time, after hour documentation that's occurring, it's very clear that there will be opportunities to save
Mhm.
time on that. The flip side of that is these tools are also incredibly expensive. So, part of our evaluation is, really coming up with a concrete return on investment and
Mhm.
identifying a way that we're not only unburdening the provider, but also can do so in a way that is financially conducive to sustaining that investment and
Absolutely.
expanding it.
Mhm. Yeah. So, very interesting corollary to that was that at HIMSS last year, we heard that, with the most successful implementations of ambient, which is a statistic that Nuance has put out, they said they're saving, each physician is saving about 6 minutes per patient, which doesn't
Yeah.
sound like a lot, but then when you multiply it by obviously, the number of hospitals you have and the number of physicians and the number of patients, it adds up really quickly.
Yeah.
So
And as we've digitized healthcare over the last 15 years, I would say most providers have not seen that as a net plus, right? It has been a
yeah.
very negative impact on their quality of work. I think COVID certainly contributed to physician burnout, but I think so has technology fatigue. And
Yes,
any
absolutely.
opportunity we can grab where we can unburden providers with use of technology, we need to seize those opportunities.
Yeah. Okay, so that's good to know that you're in the initial stages and you're going to be
Yeah.
testing it out. Yeah. So,
Yeah.
any other examples of digital programs that you would like to talk about or showcase at your
Yeah,
organization?
I think there are several that I would highlight, and I would kind of back it up to a higher level for us. As I mentioned earlier, Chip, our CEO, has really been very much driving for transformation, but I think a supporting function there is really innovation writ large, and AI kind of fits into that innovation model as well. So we have really begun to create an entire innovation program for all of RH, where we have really two parts of that program. The first is focused on internal performance improvement,
Mm-hmm.
transformation, and innovation. But then we're coupling that with an accelerator program to actually take some of those innovations to market,
Okay.
and to also partner with other startups to bring them back into RH. We're doing this in a very prescriptive and deliberate way, ensuring it's aligned with our strategy. So
Mm-hmm.
where we have opportunities, where we have challenges, we're trying to line up those companies that may actually fit and help us solve some of those niche problems. I'll give you a really good example of this. Healthcare is, currently experiencing, I think, a drop off in employees. We certainly have a challenge maintaining staffing.
Mm-hmm.
Nurses, I think, nursing is really the most acute area where we see that. But we're
Mm-hmm.
also in this perfect storm where demand is just increasing at a
Skyrocketing.
remarkable rate. So that gap between supply and demand, the only reasonable way to think about it, closing that gap, is through technologies as much as we can. You mentioned AI, and we talked about ADS, ambient digital scribe, as being a way of doing that, but there are certainly other opportunities in there. Just scheduling nurses is something that is incredibly burdensome right now and leads to tremendous inefficiency.
Mm-hmm.
Every little point of improvement that we get pays multiples in dividends as we schedule. So as we look at opportunities, good example there is nurse scheduling. Can we apply AI to actually improve the
The
speed with
schedule.
which we can do? Yeah, exactly, the speed and efficiency of that nurse scheduling. So very good example of a strategically aligned innovation opportunity that we're very actively pursuing at RH.
Mm-hmm.
And I could sort of stack those up. There are numerous ones of those. We talked about the digital front door and really trying to improve access by casting that broad digital net, but then also empowering our patients with access to the tools to provide self-service in a lot of ways and gain access to service and care as quickly as possible. It's those types of activities that we see as a through line from that innovation continuum I was talking about just a moment ago. So while an innovation may start at a very acute problem with RH, we believe that we can develop those ideas into something that can scale out across all of RH, but then also potentially go to industry.
Okay, that's really interesting. So these, the incubator or accelerator program that you're running does that have in-house participation as well, or only like other
It
startups?
does. We actually, so a great example of that is we had a physician in emergency medicine who developed an application called
Mhm.
Code Assist. And Code Assist essentially is a tool that provides a heads-up display in the form of an iPad that guides cardiac resuscitation. There
Mm,
are ACLS guidelines that specify with very specific criteria what you're supposed to do when in terms of doing resuscitation. And there are very strict documentation guidelines associated with associated with following those steps and those guidelines. So this heads-up display that we have helped develop, it essentially navigates and orchestrates the entire resuscitation event, and it documents it behind the scenes. Great example of an internal innovation that we think has real potential to save lives.
Yes.
Also unburdens our providers when they're, in an emergency situation trying to provide care to a patient. Then also, this is not a problem that's unique to RRH. This is something that we believe has potential well outside of RRH.
Absolutely.
Yeah,
Absolutely. That's a great success story. Yeah.
yeah.
So in terms of the nurses, that you were mentioning, Dwight, I think that's a very good example that you gave on the scheduling. And the other success story that we've seen is with a company that, we actually helped write the LLM for, and that's called Vivid Health. And basically they do, automatic care plan generation, which was also
Hmm.
something that was taking the nurses a long time to do. And in this case, it creates the care plans automatically and publishes them to the nurse's dashboard. And then, it saves a lot of time because then the nurse just has to review it and hit publish. So,
Yeah,
those are great examples of
yeah.
innovation. Are not
You
going
know,
diagnostic, but saving time and yeah.
yeah, and I think that is the great potential of the LLM, right? I mean, not so much that it's going to solve everything for us, but that it can really facilitate and enable
Mm-hmm.
quick summarization, but then also drafting of content. Um,
Exactly, which
Pretty
is
good at that.
basically
Yeah,
where its strength is. Yeah.
yeah,
So they've seen really good success with that longitudinal care plans and, doing the care plan generation, but still having the human in the loop to, hit the
yeah,
final push button. Yeah.
yeah, yeah. I think especially with LLMs, that's critical. I don't see that changing for at least the foreseeable future. One of my personal hobbies is I code a lot, and I use LLMs all the time in coding, and it's remarkable how good they are. But it's also remarkable about how they hallucinate and
Hallucinate. Absolutely.
will just make things up. So you have to, I think there is a definite need for caution and maintaining that human in the loop.
Absolutely. Yeah. That's why I think the RAG, implementations have seen greater
Mm,
success because you can bound it, put some guardrails around it, and then,
absolutely. Yeah.
yeah, ground it in truth. So we have a few more minutes, Dwight. I think any challenges you would like to talk about right now? What do you feel is your biggest challenge, with technology or, what do
Yeah.
you?
I mean, I think there's the financial pressures in healthcare are certainly very acute still, and I think that is, in a lot of ways, that's the oxygen that you need to have to really drive wholesale innovation and wholesale transformation. So that's certainly a challenge. I think also cybersecurity is something that is continues to be a top of mind
Huge
concern
challenge.
for any CIO
Mm-hmm.
uh, these days, and for that matter, the accompanying investments that you have to make to really tighten things up, so to speak. Those are the challenges that I see, and there is the challenges that accompany that around workforce and maintaining a team that can really drive and advance the ball. I think
Mm-hmm.
is very critical as well. But by and large, I think I am an optimist by nature. It's and a technologist by nature. I
Mm-hmm.
actually think that there is real opportunity. If we take a step back and we look at that gap I was talking about earlier around supply and demand, and for that matter, how much we spend as a country on healthcare. I do think there is good reason to be optimistic about the future and
Yeah.
how technology can play a really important role in
Mm-hmm.
helping us as a society meet the demand of healthcare and actually improve people's lives. So
Yeah.
I'm actually very optimistic.
Great. I'm glad we ended on a positive note. And it's been great talking to you, Dwight. Thank you so much. And we look forward to, publishing the podcast and having it out there. Thank you.
Wonderful. Thank you very much for the time, and I appreciate it.
Thank you. Take care. Bye bye.
Bye bye.